Good morning, Wichita Falls. I'm Tanya Robinson, president of the Gold Coat Ambassadors. I'm out here today with my Gold Coat team and at Community Healthcare Center with my CEO, Alan Patterson, my board chair, Dr. Patel, and Mayor Tim Short. Alan, it's a great day. It's an exciting day. Tell us all about it.
I'll do it. Thank you, Tanya. So good morning, friends and colleagues. Welcome to Community Healthcare Center. It's an absolutely great morning to be with you. I promise we're not going to be out here more than 45 minutes with my presentation. I know the heat's going to get up there a little bit. I'm Alan Patterson, and is that the judge?
That's the judge. That's the judge.
I'll shorten it a little bit then. Okay. And I have the distinct privilege of being the CEO of Community Healthcare Center. I'm joined today by a number of my teammates, board members, and community movers and shakers. Thank you, each and every one of you, for joining us today to celebrate yet another milestone for Community Healthcare Center. Wow, 30 years, I don't know where the time goes. Community Healthcare Center was incorporated officially as a Texas nonprofit corporation on April 7th, 1992. You've got a patient. Its official name is North Central Texas Community Health Care Center, Inc. 8 words, that's kind of a mouthful. So we've shortened it. We go by Community Healthcare Center, 3 words. A lot of times we'll call ourselves Team CHC. Sometimes we just call ourselves CHC. I'll probably go with CHC for the rest of the day here. CHC has one incredibly noble mission, just one job, that's it. And that's to increase access to and the quality of primary health care services, medical, dental, and behavioral in the communities that we're privileged to serve. The 3 original incorporators were Rosendo Rodriguez Jr., Woody Gossam Jr., and John Hershey back in 1992, 1993. The original registered agent was Rosendo Rodriguez Jr. Its first board was Dr. Edwin Bebb, Hector Medina, Richard Esparza, Rosendo Rodriguez Jr., and Angus Thompson, Pastor Thompson. The founding CEO, my predecessor, was the amazing Phyllis Haraki, who continued to lead Community Healthcare Center from its initial days, from its conception really, all the way until she was good enough to hand me the baton in April of 2015. As a surprise to her, the board placed her name on the marquee. The name of our dental clinic across the street is Community Healthcare Center. You can see it over there. Phyllis Haraki Dental Clinic, and she certainly deserved that recognition. After incorporating a clinic like ours, it takes a few years, frankly, to be able to get what's called your federally qualified health center designation, FQHC, Foxtrot, Quebec, Hotel Charlie. That designation is an incredibly difficult designation to get. It's a special designation. If you're fortunate enough to be able to have the community resources to pull it off, which not a whole lot of people do, only 15% of the applications that get submitted ever get approved. So this community pulled it off on its first attempt back in 1993. The designation was approved in spring of 1994, and this particular clinic saw its first patient on then July 15th of 1994. Since then, since that time, it's had essentially a 12,000 square mile service area. So all of the counties around Wichita, not in Oklahoma, though we get a lot of Oklahoma patients, our service area is all in Texas, sort of the 14 or 13 counties surrounding Wichita County. That service area is larger than 9 U.S. states. That's how significant your Community Healthcare Center is in North Central Texas and really in the grand world of community health centers. For its first year, 1994, it was open for 6.5 months. We did 2,267 clinical visits to 991 unduplicated patients. And we did so in a manufactured housing that I think it was on this city block, like right over here, yeah. Since providing that first year in 1994, we've grown just a little bit. Last year, in 2023, we provided 122,217 medical, dental, and/or behavioral visits to 31,386 unduplicated patients. And we did it at 15 sites, 8 clinical sites here in Wichita Falls, 2 administrative sites in Wichita Falls, 3 clinical sites in Collin County, and 2 clinical sites in Wilbarger County, specifically in Vernon. So in 2023, this last calendar year, we provided 5,391% more visits than we did in 1994, and we served 3,167% more unduplicated patients than we did in 1994. Those percentages, they calculate to an average annual increase over the 30 years of a 14.22% for visits and 12.2% for unduplicated patients, respectively. Every year, that's the average. How would you have liked to have earned 14% and 12% on your investments over the last 30 years? We would all be smiling, maybe sitting at some resort somewhere, smiling about how well our investments did. Well, that's what Community Healthcare Center, being a part of this great community, has been able to do for the community that it's been able to serve all these 30 years. Cumulatively, this is a cool stat, since our first visit on June 15th, 1994 through last Monday, I had to actually estimate the month of September, but I had all the other months exact. We've provided 1,552,933 primary medical, dental, and behavioral health care visits to our family, to our friends, and to our neighbors. And that is what we do, and we're kind of proud of that. So while we know CHC, Community Healthcare Center, is not perfect, we also know our pursuit of perfection is why we're so damn good. And we thank you all for that as well. Here's to 30 more years. The previous 30 were fantastic for this community. The next 30 will be equally as good or better. I will also thank the Chamber of Commerce, the Gold Coaters, our board of directors, my teammates. There's 310 employees at this health center now. We're, I think, in the top 25 businesses of Wichita Falls. I think we're number 23 last time I looked. And we are so incredibly proud to be a part of this community. Thank you.
Thank you. Thank you very much. Dr. Patel, you have anything to add? Okay. Mr. Mayor, you're up.
Well, thank you very much. Finally, the next thing following me is not the buffet, so, because they tricked you, and that's later tonight. So, you know, I love this city, I love this community, and you obviously do as well because you put it in your name. Thank you so much for caring for so many of our friends and neighbors for the last 30 years, and I hope God continues to bless your mission here. I also say, you know, go early, stay late, and help people. And you know, I fall short of that, but you all never do. And we appreciate everything that you all do here. Now we'll make this special day officially special. From the city of Wichita Falls. Whereas in 1994, the Community Healthcare Center was created from an organized community effort, recognizing a need for quality health care to patients of North Central Texas. And whereas for 30 years, Community Healthcare Center has provided high quality, affordable, comprehensive, primary, and preventive health care, delivering value to and having a significant impact on our community and on our local healthcare system. Whereas a significant primary care network, Community Healthcare Center is a health home for over 31,000 patients. The Community Healthcare Center employs more than 300 people, physicians, dentists, nurse practitioners, physician assistants, and behaviorists, who work as a part of a patient-centered medical home designed to treat the whole patient. So therefore, I, Tim Short, the Mayor of Wichita Falls, hereby proclaim October 3rd, 2024 as Community Healthcare Center Day.
Awesome.
Thank you
Thank you
very much.
Thank you. Thank you. Thank you. Thank you. Thank you. Thank you. Okay, are we ready to cut a ribbon? Everybody? Okay. Dr. Patel, I'll hand these over to you. Nancy, you want to join him?
Join in.
He's capable.
He's capable? All right.
Yeah, he's surgeon.
On behalf of the Chamber of Commerce, the Gold Coat ambassadors, and the businesses we represent, let's count down, everybody. Ready? 5, 4, 3, 2, 1. Woo!
Thank you.
All righty.
Thank you, everybody, so much.
Thank you, thank you, thank you.